Hi everyone, welcome to Origyn IVF. I am Dr. Rashmi Sharma and today we are going to discuss recurrent pregnancy loss. Okay, so we are going to discuss about patients who have multiple miscarriages. This is a very distressing and depressing condition both for patients and for doctors, where the babies are getting aborted again and again and again and again. Okay. Before that, if you wish to consult at our center, the number is given below at the screen. You can give a phone call and take an appointment. Or if you wish to consult online, then the link for online consultation is given below in the description box and you can consult us online. Okay. So now coming to the topic, recurrent pregnancy losses. Okay. So if there is a patient who has got just one abortion, okay, so that kind of abortion is very common. About 15 to 20% of the couples will have one abortion. Okay, so at one abortion, no tests are advised. Okay, it is said that these kind of abortions, they usually happen because the baby that has formed, the god that has formed the baby is abnormal, and that is a way of nature to remove the abnormal embryos. Okay, so once in a while it can happen that the baby which formed was abnormal, and so that's why it didn't survive. Okay, so at just one abortion, normally no tests are done. But if there is a patient who is aborting again and again, like 2 abortions or 3 abortions or 4 abortions, so it cannot be by chance. It cannot be just bad luck every time. There has to be a reason for that. Okay, so then we need to do a lot of tests to find out the reason. Okay, the reason could be either the baby is not good or there is something wrong in the maternal environment which is not supporting the baby, and accordingly systematically lot of tests are done. In spite of doing lots of tests, there will be 50% such couples who are aborting again and again, but we are not able to find a reason. So 50% of the patients will have unexplained losses, okay, where we are not able to tell them a cause. We are also helpless. We have to tell them that sorry, we don't know, the science doesn't know why you are aborting again and again. But there will be 50% patients in whom we will be able to pinpoint a cause, and the chances for for a future normal pregnancy becomes better. Okay, so in two conditions patient can come to us. One is she has got 1 or 2 earlier abortions and now she is right now pregnant, and just now the ultrasound has told us that the heartbeat is gone or the pregnancy is not doing well, the baby is still inside. Okay, and then she has come to us for consultation. The second type of patient may be where already 2-3 abortions have taken place. She is right now not pregnant and she has come in the interim period to us for consultation. Okay, so if you have come to us when the baby is still inside, then we have to do a DNC, which is dilatation and curettage. And we have to do cleaning of the uterus, take out the baby pieces and send those pieces for genetic testing. Okay, first of all we have to find out whether the baby was normal or abnormal. Okay, so the genetic testing is done through an advanced technology which is known as microarray. We don't do a simple karyotype these days. We do an advanced microarray technology which tells us whether the baby was normal chromosomally or not. Okay, so if the report comes out to be that the baby was abnormal, okay, then we got our answer. We got the answer. We don't need to do hundreds of tests for the mother. We got the answer that yes, this abortion happened because the baby was abnormal. And depending upon the type of abnormality that is found in that tissue, in that genetic tissue, then we will decide whether we need to test the parents, whether this kind of abnormality can happen again and again or it was just by chance or bad luck. Okay, so sometimes in some of the cases parents karyotyping will be done or parents chromosomal testing or genetic testing would be done. Okay, if the baby's report comes out to be normal, that means it was a normal baby chromosomally, then we have to see why it got aborted. That means there was something wrong in the maternal environment or in the mother's body that which it did not support the pregnancy. Okay, then we have to do many tests for the women. Okay, in the women the problems could be either hormonal. Okay, in the hormones there could be uncontrolled diabetes. Okay, so we need to do sugar testing. There could be uncontrolled thyroid disorders. So we need to do thyroid testing. Then sometimes there could be PCOD, polycystic ovarian disease, and sometimes there are thyroid antibodies, anti-thyroid antibodies. So these are the hormones tests, just simple blood test. Doctor will just write down some blood tests for you, and you just need to do those simple blood tests, and that will tell us whether you are suffering from some hormonal disorder which makes you prone for repeated miscarriages. Okay, if the hormones are normal, then we have to see, is there something wrong in the uterus? Because sometimes there is something wrong in the shape of the uterus. Sometimes there is a wall inside the uterus, which medically we call it as septum uterus. So by 3D ultrasound, by a good doctor, we can see whether the shape of the uterus is normal or not. And sometimes, in some of the cases where there is some confusion in the ultrasound, because ultrasound is just a shadow. Sometimes, we're not sure by just ultrasound. So sometimes we advise you hysteroscopy. Hysteroscopy, wherein we put in a telescope inside the uterus and then check whether the uterus cavity is normal from inside or not. Okay, so we have tested your hormones and then we test your uterus. If both these things are normal, then we also have to see a clotting disorder. Okay, so there are certain clotting disorders where the woman has, a tendency for making clots in the blood. The blood is, you can say it's extra thick, and the clots form easily. So what happens is, when the baby is developing, so baby has, few small blood vessels and the blood is going to the baby, and suddenly a clot comes and the baby's heartbeat stops because the clot has stopped the baby's heartbeat. Okay, so doctor will advise you certain blood tests to rule out those disorders. That is known as anti-phospholipid antibody syndrome. So there are 3-4 blood tests for that doctor will be advising you. And if you happen to be around 30-40% patients will have that kind of clotting disorders. So if a test comes out to be positive for that disorder, then the treatment becomes easy for us. Then the treatment becomes hopeful, because in that case we will be giving you an injection, which is a blood thinner injection, which will not let clots form in the blood. Okay, and that injection will be given to you throughout 9 months till delivery. And with those injections, then there is a great hope that you will get a normal baby at the 9 months, at the end of the 9 months. Okay, so these are the tests for the mother. If all these are normal, okay, and let's say we have not done the genetic testing because you came to us in the interim period, we did not have that fetal tissue for genetic testing. Okay, so first we will do the mother's test, and if those are normal, then we would like to do genetic testing of the parents, mother and father. Okay, to find out if there is some genetic abnormality in them. So there will be 2 to 5% couples in which there will be something wrong in the chromosomes of either the mother or the father. Okay, they are balanced chromosomally, they are absolutely healthy. They don't know that they are carrying some genetic defect, but when it forms a baby, there is a defect. Okay, and that can happen again and again. Okay, this will happen in about 2 to 5% of the couples. So if a genetic abnormality is found in a couple, in about 2 to 5%, then that couple will be sent for counseling to a geneticist or a genetic specialist. And depending upon that, what kind of abnormality is found, because there could be 1,000 types of abnormalities. Genes is like a huge book. So depending upon what kind of abnormality is found, the further course of treatment is decided. Whether we want to leave you for natural trial, or whether we need to do some advanced technology like IVF and PCOD. It will all be decided based on what your genetic report says. Okay, so all said and done, I would say that don't lose hope. I know it's a very painful condition, it's a very, very depressing condition, and it is, we can feel the pain of the patient, sitting across the table from the patient so many times, we get their emotions, and we also feel so sad. Okay, but then the good thing here is the statistics tells us, the world statistics tells us that in spite of 4 to 5 abortions, there is a 50% chance of having a normal baby at the 9 months. Okay, whether you take it in a positive manner or whether you take it in a negative manner. In negative manner, you will think, oh, there is a 50% chance of a repeat abortion. But in the positive manner, there is a 50% chance that you will get your own baby. Okay, and believe me, there are so many patients, so many, in fact, in my own practice, I've got so many patients who have got, happy families after 2, 3, 4, 5, 6, even 8 abortions. I have a patient who had 8 abortions. all treatments done, everything done, and suddenly the ninth pregnancy continued on its own. So, you never know. Okay, so don't lose hope and just go to a good doctor and do systematic testing. If you are able to find a cause, we will be able to help you. Even if you are not able to find a cause which is unexplained, with good, tender, loving care, means with a lot of moral support and mental support, and of course a little medical support, there is a very high chance that you will have a healthy baby. Okay, so don't worry. If you have got some questions, you can write down in the comment section, and I would be very happy to answer them. And if you liked the video, then you can like and subscribe our channel. Thank you so much.